So first of all, welcome to all of you, and then welcome Zelda.
Thank you.
Good to have you. Zelda is going to introduce herself. Zelda, tell us a little bit more about who you are, what you do, where you come from.
Okay, I'm Zelda Janse van Rensburg. I'm a registered nurse and midwife. I am currently full-time employed at the University of Johannesburg as a lecturer there, where I do a lot of research and supervise masters and PhD students. And in addition to that, I've got my own business, which I run on the sideline, everything mom and baby, birth and pregnancy related, which I thoroughly enjoy. Um, and I'm born and bred in Pretoria, and I've got a beautiful little 8-year-old daughter that I think can teach you more than anything in life.
Wow, thank you, Zelda. I'm so honored to have you here with me, and
Thanks so much for
we,
having me.
we share so many passions. And I know we're going to be talking a lot after the show, but today's topic is going to be about delayed cord clamping, and that is a term that you might all be very familiar with, or it's something like, what is that? Well, that's what we're going to explain first. So, what is delayed cord clamping?
Okay, so when we talk about cord clamping or umbilical cord clamping, we talk about two things. So the first one is immediate cord clamping. So I think that's what we as midwives, most midwives have been taught, and I think me and you, we've
Mm-hmm.
been taught that to clamp the cord immediately. And that's from anywhere from 10 seconds to about 30 seconds after the birth of the baby. So, and then delayed cord clamping, or the term that's better used, the optimal cord clamping, um, that is the World Health Organization definition of that is to wait at least 1 minute after the birth of the baby. Um, the ideal is at least 3 minutes or until the cord has stopped pulsating, and then to cut the cord. Which this allows the blood that is still in the umbilical cord to go back and flow back to the baby and give that baby that blood volume back that is still in the cord.
Yeah. So Zelda, you say a lot of things. I want to just cut it down a little bit. So for those that are not familiar with delayed cord clamping, you said it means that you just wait before you cut the cord. And why is that so important?
Okay, so when you wait to cut the cord, so when mom is still in in the stomach or in utero, and the baby gets the food, if we can put it like that, through the placenta, um, the blood that is in the cord is still the baby's blood. Right? The
Correct.
blood of the mom and the baby never really mix. You get the nutrients through the placenta, through osmosis diffusion.
Mm-hmm.
So the blood that's in the cord is still the baby's blood.
Yes.
And when we cut the cord early, and or not allow that blood to flow back to the baby, we're actually depriving that baby of about 240 grams of blood, right, which is almost 150 milliliters to 180 milliliters, depending on the size of the baby. Um, so allowing that time to go past, allow the blood to go back to the baby's heart, and then we call it a transition phase from when the baby's born up to where the baby takes on its own body and starts working by
Correct.
itself, if I can put it in that terms. And then that gives the baby iron stores, oxygen, and helps with respiration, all those things that the baby just needs to make it a little bit easier in that transition phase. Which when we cut the cord early, the baby is actually deprived of his own blood,
Yeah.
his or her own blood.
Yeah. So for me, now talking about it, it's a no-brainer that baby
Yes.
belongs to the blood belongs to baby, and it still contains so many stem cells.
Yes, stem
And
cells, of course. Those
yeah.
stem cells and the immunological benefits that goes with the stem cells alone is so massive. And then the red blood cells with all the oxygen and the iron in it.
Iron, yes.
And those iron stores that we give back to that baby last the baby for the first 6 months of their life. That's enough to keep them going for that first 6 months
Wow.
of their life. Yes.
Wow.
So, yeah.
So what would we deprive them of if we cut the cord immediately? What?
So if we deprive them of iron stores, we deprive them of oxygen, we deprive them of... studies have actually been done to show that if babies that had delayed or optimal cord clamping, they were tested at the age of 4, and they actually found that these babies that had this delayed cord clamping actually scored so much better in assessments of cognitive ability, fine motor and gross motor skills, because the physiology behind it is that increased oxygen and the increased stem cells actually help with the formation of the myelin sheath in the brain, which is the sensory conductive pathway in the brain. And that actually gives them a better IQ.
Sure.
So that's a very interesting study that was also done.
Yeah.
So we are depriving them a lot.
Yeah, we
by
do.
By not giving them their own blood back.
Yes, sure.
Yes.
So I just wanted to really get that message across, that we understand, okay, this should be a no-brainer. It's baby's blood, but then let's try to find out what went wrong then, because Zelda, you and me both have been trained as a midwife, like, hey, cut that cord as soon as possible.
Yes.
And I think even in emergency trainings, when you think if you have a baby on the road, what you do is just make sure you have a shoelace to what is the big deal there? What went wrong?
We see these things on movies.
What went wrong?
So so in the past, in the 1800s and even before that, the babies were delivered by midwives, which is not formally trained, or by the all elderly moms and grandparents, and then they took a string and tied it off the umbilicus. So and then cut it with whatever knife or sharp object they could find. But in those days, delayed cord clamping was called 1 minute, or early cord clamping was 1 minute.
Interesting.
And then delayed cord clamping was 5 minutes and even until the cord stopped pulsating. In those days. And then there were much research done. One researcher, his name is Pierre Darwin, he did a study where Erasmus Darwin, that's his name. In the beginning of the 1900s, he already came up with the nutritional benefits of delayed cord clamping, and saw that there are these benefits. And it's only then I think it was 1988, where the first surgical cord clamp was actually produced. And that was for the main reason that they were trying to decrease infection from the tying of the cord and using a normal knife or whatever sharp object.
Right.
So that was the main reason, not for cord clamping or doing it more immediate or anything like that. So it's only in the end of the 19th century, in the 20th century, that things changed, where the midwives actually became trained, and then immediate cord clamping just happened. And all this that was in the past actually just were left behind.
Very interesting that you say that originally delayed cord clamping was already more a minute.
Early cord clamping was 1 minute.
It was already early cord clamp was 1 minute, and now we just do it straight away.
Yes.
So
yes.
Yeah.
So that was actually correct already back then. So the reason why it changed in the 20th century is that there were more obstetricians doing deliveries. There were more surgical deliveries or cesarean sections, more trained midwives. But then again, even in today's day and age, I think our midwives and our human resources are limited. We've got a lot more babies being born every day, with limited amount of midwives. So I think it's the rush of getting the job done, and getting midwives just to do it and get it done. And I think we were both taught like that. I remember working in the maternity unit and being taught just deliver it, milk the cord, cut it, baby's taken away from mom, there's not even any skin to skin or anything. That's the way I was taught. And when it actually became interesting to me was when I actually started giving antenatal classes and educating moms, and I found delayed cord clamping, and I found it so interesting. I was like, why are we not doing this?
Right.
As a midwife, I was never taught this.
So you discovered by your own research this is the way to do it.
From my own research. And then I decided to take it a bit further and just go and see what is out there and what is so do a little bit more extensive research on the topic.
Wow, so it started just by personal interest, and you started to come across, because it is a very much research topic internationally now.
Yes.
So it's something that we've identified all over the world, like, hey, we can do better here. And now you're actually supervising a study on this topic, so you're really diving into the research. And what are you finding through the study?
Well, in this study, there's lots of studies being done about the benefits of delayed cord clamping, which we'll discuss a little bit later, but and the physiology about it, and the benefits for preterm babies. But there's absolutely no study in South Africa looking at the knowledge of midwives on delayed cord clamping. So I found it interesting. I wanted to know, what do midwives in South Africa know about this topic? What do they know about delayed cord clamping?
And how about doctors?
Well, that's
next study.
That's a study on its own.
Yes.
But just midwives, because I think there's a lot of midwife-led obstetric units in South Africa. I think in our public hospitals, a lot of midwives are doing deliveries. I think we are going back to private midwives doing deliveries. And I know a lot of private midwives that do delayed cord clamping. So this study was basically not on the private midwives, but the ones working in public hospitals. Just go and see, what do they know. And what we found is that almost 60% of them said, yes, we are doing it. But when we asked them, so how are you doing it? When should you do it? They were not sure. So it's actually very controversial. Like they say they're doing it, but they don't really know how or what they are doing.
They might just say that because
they feel embarrassed.
They know it's the study, and
or they know they should
be
the
study,
doing
and maybe
So knowing what you should, or that you should do it, and actually doing it is something different. And then
why would that be? You think? Then I mean,
I think it's a lack of
knowledge.
Are they
uncomfortable? Yeah.
I think they're uncomfortable. I think it's a lack of knowledge. I think they know that they should do it. And I think it is. Well, we also asked them, do you know of any policies in your unit? Do you know of any policies in the world that or guidelines that tells you about this? And about 60% of them then again said, I'm not sure. I don't even know if there's anything like this in my unit, whether there's in the world.
Right.
So so the World Health Organization do have guidelines in place that states how delayed cord clamping should be done and the steps. But in South Africa as such, there's no specific guidelines available, or something that's available that can be put up in the delivery units or something like that. So that's something that we're aiming for.
Right.
I think when we asked them about the knowledge, it wasn't to attack these midwives, to say you don't know anything. We wanted to find out, because we want to empower midwives to say, we see you don't know, let us teach you, let's teach you the benefits, let's get you to do this and make it a standard practice in South Africa.
I like that you say that. So if you are a midwife and listening out there, just understand that this is the heart behind it, and also behind this talk is empowerment. And I think that is where we are with all the midwives, because there was also a moment where we had to realize, hey, this needs to be done different, and where we learned to do things different. I mean, really, quite frankly, as students, we were also like, cut the cord, and that's what you've been taught, and that's been your frame of reference, till you realize, and it's like a aha moment, and then you start practicing like that. So I think there's a lot of unlearning that needs to be done in midwives, and a lot of like with understanding why we do things and asking a few questions, then starting implementing that. So that is just basically what we want to achieve here. It's just the understanding.
So a lot of midwives just say, like, it takes time, we're so busy. And all it takes is 1 minute. When you deliver the baby, put the baby skin to skin on mom's chest.
Which needs to happen anyway.
Which needs to happen anyway, and it's got its own benefits. And then while the baby is on the mom's chest, the immediate care of the newborn can be done. I mean, the respiration and the heart rate and everything would be so much better skin to skin. And now we've got the benefit of delayed cord clamping, which has already increased oxygen and the iron to the baby, helps with respiration. So it's a win-win situation at the end of the day.
It really is a win-win, and I just think we cut ourselves so short by just hiding behind being busy, because down the line you're going to save time. So the better you conduct birth, the better you help that first phase of baby, You're going to have a healthier baby, you're going to be a happier mom, the
and
breastfeeding will be better, so you're going to save time so much down the
and
line.
it's less hospital stay for this baby and for mom. And then the question that comes up a lot is, well, so for mom, is mom not going to bleed out? Or and several studies have been done on this topic, and to see that it's got no influence in postpartum hemorrhage.
Not at all.
That's initially why the practice was changed, because they thought that if they delay cord clamping, mom's going to bleed out, and that's just the total opposite. If this baby is given back, the blood is given back to the baby, mom would bleed less.
Yes, exactly.
And the postpartum hemorrhage is less than what we actually think in just cutting the cord. So it's less risk for mom, it's better for baby. So mom and baby has less hospital stay. In the long run, it's got such a improvement on the cost of healthcare. So benefits all around.
No, absolutely. So let's just talk a little bit to our moms that are listening in today on Cecilian Center side. So what do they, if you're a mom or you're pregnant and you need to go give birth, and now you're hearing all these things, you've never thought about it, you just think, well, my midwife or my doctor should know, but unfortunately they don't all know and they don't all implement. So what would you like them to know?
So I think knowledge is key. I think if you go and do research and you go and look at the World Health Organization's guidelines on delayed cord clamping, it sounds like a big thing, but they have broken it down in such a way that every person can understand it, and to empower yourself and to know what is it about, what's the benefits, and to discuss this with your obstetrician and or your midwife, just to say, I've read this, here are the proof, what do you know about it, and can we do this? It's an option, let's give it a try. It's only 1 minute minimum. You can do it longer than that. You can even deliver the placenta and have the placenta attached in a kidney bowl next to you for longer than that if you would like. So that what we call lotus birth. So you can even do that. But I mean, 1 minute is, I think it's not too much to ask for. And empowering yourself, just knowing that the option is there and you can ask for this.
I would even go a bit further, 1 to 3 minutes, or don't cut it at all, get the placenta out. When that cord goes white, and when there's no pulsation in the cord and it's white, and you know the blood is all inside the baby.
I think everybody is always just so focused on this baby, getting this baby out and getting this baby to breathe, and this rush. And yes, there are times when we have to cut the cord immediately, when there's severe respiratory distress or asphyxia or something like that, yes, or the baby needs to be warmed. But even if the baby's struggling to breathe, you can dry the baby, rub the baby 2 to 3 times on the back, and that's in the World Health Organization's guidelines.
I would actually even say, even if there is asphyxia or problems, then the best resuscitation is to keep the cord intact.
Yes, they say at least for one. Try at least for 30 seconds, at least 1 minute, but at least the longer you can, the better. And even if you can resuscitate while that cord is still attached or on the mom. Not all facilities allow this, but if there's a warmer needed, then bring the warmer next to the mom if you can, by all means.
But this is like the incubator.
But here is the incubator. You can resuscitate while on mom's chest, and I mean that's the best thing you can do. So for moms, just know the option is there. Go and read about it. Talk to your obstetrician, talk to your midwife, say, I've heard about this, tell me more. And maybe they would be triggered to go and read about it a bit more. If they didn't know about it, wow, my patient knows about this, how do I not know about this?
So let's help them with a few of those standard answers from doctors. So sometimes they say no, but it's going to get, it's a higher chance on attracting jaundice. Yellow, or what's that the deal about that?
So there is a slight chance of jaundice when you do delayed cord clamping, because the more red blood cells that goes into the baby's body, the liver is a little bit still immature to break down these red blood cells. But the benefits of giving those iron stores and oxygen or oxygenated blood outweighs the risk of the jaundice.
Exactly.
So if you're delivering in a hospital or even by a midwife, your midwife and your obstetrician, and then you've got a pediatrician as well, would be able to recognize jaundice early, and there are the options of phototherapy, and sometimes it's not even needed.
No,
So it's really a slight increase.
I doubt it even, because I've
Yes.
never ever seen it by any of my babies that I've birthed naturally at home or in a natural birthing setting. I've never come across that really. I think it's an excuse.
Yes.
I think what makes babies jaundice worse is when you milk the cord.
Yes.
And because then you damage blood cells. So don't do that milking of the cord, whatever. Just leave it. Just can we just be a bit more sensitive around birth and delicate and
just calm
and just have a bit of a holy moment. This baby's out, and just leave it. You know.
Exactly. Just calm down.
Yeah.
And I think it is difficult when you're working in a rushed environment and there's a lot of pressure. But just to remember that 1 minute. They talk about the golden hour, just that 1 minute after birth.
Yeah.
I think that should be also like the golden 1 minute after birth. It should also be.
No,
there.
I mean, what is more important, Tariq? Really,
Yes,
you know.
yes. So and I mean, your baby proving that the intellectual ability even improves that. So the moms can really play that card.
Exactly.
And just say, well, and go and read about some studies that have been done. There is plenty and plenty out there.
No, there is so much out there, and I think it is good to realize that it is something, and unfortunately this happened a lot in our birth world, that has just crept in, and then we've just all accepted it as a norm, and we actually have to unlearn a lot of things that's just become practice, normal practice. So what Zelda explained, that back in the day it wasn't like that, you know, and we can see like modern medicine is it, but it's not always
it's not always
and we need to, and that's why research is so fantastic these days, and I'm so happy you tackling these important topics with your students.
Yeah, it's very interesting.
It's so interesting and it's relevant, right? So let's just finish off with a round off for midwives, what they need to know, and also maybe how they can implement it in their unit, how they can just be practical.
So for midwives, again, it starts with knowledge. Knowledge is power, and to know what it's all about. Go and read. And then in your units, it's to have a policy on this and operational procedures that states what should be done, and base it on the World Health Organization guidelines, because it's there and it's relevant and it's it's appropriate to use. It's not just thumb sucked. So have that in your unit, or even in your private practice as standard practice. I mean, for midwives to know that when that baby is out, to put the baby on skin to skin, and everything that must be done to that baby can be done while on mom's chest. That baby does not need to be weighed immediately. They're not going to lose weight in an hour. So leave the baby on mom's chest at least for that hour. Totally. They're not going to lose weight. That baby's not going anywhere. So you can even identify the baby after an hour or after 1 minute, for that matter. So things like that, just that hour must just be golden. You can even leave the baby and mom and deliver the next baby, come back, and then do all these things that you have to do. And you can, in that while the cord is still intact. I mean, cut it after 3 minutes. It takes about 5 minutes usually for the cord to stop pulsating.
It's just a mind shift change.
It's a different way of practicing, and it's shifting your mind and just getting a different routine.
That's right.
As from what you've been taught and what you do daily. And it is difficult, because change is difficult. And people don't want to change their practice. But I think especially us young midwives coming in. Not that young anymore, but our young midwives. Younger midwives. And especially our newly qualified midwives. And I think that is what for my students, try and teach them these things, and to change the curriculum in such a way that the midwives are educated about this, and that they know what the practices are, what the latest research are, to change the shift of midwifery in a good way. That's
it. So thank you, Zelda. I'm just looking if there's any questions as I come through, because you're allowed to ask questions, but nothing has come through as yet. But if there are questions, you can put it in the comment section, and we'll make sure that we'll get the answer to you on that. But I do think it's really not rocket science what we've been talking about, and it's good to know that there's so much evidence behind it, and it's just good for you to be aware for a new mom that there is something like an optimal the cord clamping thing. We don't like to say delayed because it actually should be optimal. It should be the norm, but just be aware of that and just make sure that it happens at your birth. Lastly, I also really want to specify the importance of this happening. Even if you have a complicated birth, a premature birth, or a cesarean section, even.
Yes. So this can even be done during cesarean section. I mean, the obstetrician can also wait 1 minute, or they can take the placenta out, put it in a kidney dish right next to the bed or on a table, and they can go on doing what they have to do while you are skin to skin with baby. You're out of the operating field. There's no risk for infection. Mom's happy, baby's happy. Even if you're preterm babies, especially in preterm babies, delayed cord clamping is so important because the stem cells that's given to that baby, the increased red blood cells, it decreases things like intravascular haemorrhage. The gut gets more blood, so that necrotizing enterocolitis is not there. All these things that babies end up with in the neonatal ICU can be prevented by just doing this for 1 minute. In your preterm babies especially. So if you can think just what it costs for one baby to be in the neonatal ICU for a day, 1 minute, I mean, really, the benefits outweighs the cost for doing this. Yes.
No, absolutely. So thank you so much, Ella, for just sharing this very important information, and it's been really wonderful to talk on this level. If you have any questions, one more time, you can just post it to us. We'll see if anything has come in. Not yet. And then we will see you next time on the live show. Is there anything else you want to say lastly? Or is this us for today?
Just stay calm and delay cord clamping.
That's the easy message of today. Hope you enjoyed that. It was super insightful, and
thanks for having me.
Thanks for being here, and all the best with the finishing of that study. So that's us. We'll see you next week. Thank you for tuning in, and if you want to be in the show next time, you must just send us a message. You can also be a guest in the show. So that was us. Have a lovely rest of your day. Bye.